good day. It's good seeing everybody, and it's good for me to be back. I've missed, and I'm glad to be here. I'd like to remind you that in accordance with the State Government Ethics Act, the duty of every board member to avoid both conflict of interest and appearance of conflict. If you find yourself in that situation, you just let us know. We'll take the appropriate situation at that. Look at the minutes. We have seen the minutes by the computer, the internet. Anybody have any corrections or additions? If not, do I hear a motion to approve them as presented?
So moved.
Heard a lot of so moved.
Second.
Okay, I didn't know what was here. Okay, I was trying to figure out who it is. Any questions from anyone? All those in favor say aye.
Aye.
So be it. We have good news. I don't know whether the good news is because Gibby's not here or whether or not it's a national conference. But she says she will do this. But I have a message here that says Gibby's not here and I'll do this.
That's good news for me because Gibby appropriately so takes such pride in our public health staff that I never get to be the one that acknowledges their work. So it's good news for me, if not for Gibby. Gibby is in Washington at a national conference and is having an opportunity to meet with our delegation to talk about both federal and state issues. So we're grateful for that. But I would like to ask our disease control staff to come up. And they're all going to hide back there in the back, so I'm going to call their name when they don't come. Ellis Vaughn, Sue Ellen Morrison, and Susan Creed, and Karen Robinson, and Karen Splite. And I don't know if Dr. Mullendore came here or not, but Dr. Mullendore has to come up too. She can go right now. These are a group of very skilled, talented, and committed individuals who the community can take for granted, but they really are the wall between all of us, public safety and communicable disease. They do investigation and surveillance and monitoring, and you know, if you really let yourself think even for a minute what our community might be at risk for if it wasn't for their dedication and their skill, we all owe you a debt of gratitude. We receive a lot of really nice correspondence from consumers and patients about our staff, and we acknowledge every one of them. Senior leadership acknowledges every one of them, whether it comes in a comment card or an email. But we received one on behalf of disease control that I think really touched all of us, so we wanted to share it with you. And I am going to only use first names. And I'm going to take off my glasses because I'm old. This is Charlie, the fellow who was desperately ill with meningitis this time last week. I cannot properly express to you how grateful I am that the health department was there to protect my friends from what I know firsthand to be a terrifying, costly, and painful illness. I'm sure you're already aware that Susan Creed went above and beyond delivering medication to many of my friends in the height of the snowstorm last week. I've not met Susan in person, but through our extensive talks on the phone and on my friend's account, she is surely a great civic servant and an awesome lady in general. She even took time out of her Saturday last weekend to deliver medications to one last straggling hipster in my staff. I'm so impressed not only with Susan, but the reaction of the health department in general. If the entire government functions with that timeliness and dedication, well, that's another discussion. Again, I cannot thank everyone at the health department who I know is involved in this properly, but I hope this is a start. We really want to say thank you. I think we all believe we have the strongest medical director in the state, and everybody relies on Dr. Make us very proud.
Thank you.
We'd let y'all speak if you want to.
We're too busy, we gotta go.
That is definitely great news, and it's something that Buncombe County needs to be very proud of, and we're very proud of that unit. Thank you so much. Bring us to Jim. I think you're going to talk to us about the update of the Budget, plus you're gonna tell us about the billing update.
Yes, sir. Thank you, Mr. Chairman. Good afternoon. I wanted to, on your iPad, give you an update on the fiscal year to date for expenditures. And as we do at this point every year, we also will give you an update on where we stand with revenue so that you have a picture of the whole picture of where we are. So we'll start with the DSS budget. We're at 58.3% through the fiscal year as the end of January. And you'll see mainly through the graphs that we're right on track with most of those. The two areas, and we've talked about those before, were the capital, and that were prior expenditures that we had, and contracts. That represents mostly community contracts where we have to pay some of those forward so that those dollars are spent so that the organizations have the dollars to pay benefits on our behalf. Everything else you'll see is within the budget, and we're right on track right where we should be. I'm happy to answer any questions that you might have for the DSS portion of expenditures. When we go to public health budget, you'll see that again we're at 58.3% of the year, and our spending is certainly on track, and it's on track historically as well, based on how we spend throughout the year. And that capital is what we've talked about before, based on prior expenditures that were capitalized, that county finance put there. You see by county unit, you'll see that we're right on track with our spending. Happy to answer any questions about the expenditure side for public health. All right, let's take a look at revenues. What we do with revenues is we don't present those every month because they are actually a reflection looking back. And sometimes revenues come in as expenses are created or done or made, and sometimes revenues come later. So it doesn't really give you a good picture of where we are. So we do that twice a year, once at the midpoint, and we'll give you a full update at the end of the year as well. So just as a point of reference, we're looking at DSS revenues, and if you've had an opportunity to look at the graphs, the dark green on the left-hand side represents the budget. And you'll see a line there in the graph that says this is the budget halfway point where we should be. And then the bar graph just next to the green, you'll see sort of a tan, and forgive me if I don't get my colors right, but the tan, it represents where we are right now in terms of revenues received. And then the lighter green represents where we believe we'll be at the end of the year in terms of revenues. In the DSS world, unlike public health for the most part, in the DSS world, most revenues are generated based on your expenditures. So in other words, if you spend money, the federal and state government will reimburse you for at least a portion of your expenditures. So that's what you're seeing here. So when you see that our revenue projections are going to be 94% for public assistance, 91% for income maintenance, and 98% for child and family services, for example, look at that. That doesn't mean that we're not maximizing our ability to gain revenues. It just means that we've not spent the full 100% of expenditures in order to draw 100% of the revenues that we receive. Now, just as a point of clarification, you'll see child and family services is the highest one at 98%. That really represents, because most revenues that we get through child and family services are block grant revenues. They're not an open-ended revenue stream, such as income maintenance. Income maintenance, if you spend money on staff, you get 50% of that money back. Without a capped, it's not a capped allocation. In the child and family services world, almost all of revenues are capped allocations. So naturally, we're going to maximize those, and we're going to draw most of those down. And then you'll see in the others with emergency assistance, 100%, because those are dollars that we're going to spend, and we're going to get 100% of that back. So you look at the bottom line, you'll see that based on our projections, we anticipate to get 95% of the revenues that we've budgeted. And again, that's purely based on mostly our planned expenditures. And most of that's driven in the income maintenance world. You have any questions about revenues?
Yeah, what are we gonna do about adult services? How are we gonna make up that difference?
Oh, thank you for pointing that out. Adult services, that's 131% of where we are anticipating will be. We'll get 131% of the revenue that we had budgeted. I hate to tell you this, but most of that is a coding error. Most of that should have gone to income maintenance, but it will be reflected, and I said, that's what it is, so we're gonna show it.
Okay,
And it will be reflected at the end.
okay.
Thank you for that. Any other questions about DSS? Let's look at public health. Public health, you see, is really very different. Public health, most of the revenues that we do, particularly in the clinical world, are as a result of our collections for either Medicaid, Medicare, private health insurance, or from self-pay revenues that we gain. So you'll see for community health services, we anticipate that we're going to get 101% of those revenues. And a lot of that has to do with increased grant revenue that we received from Nurse Family Partnership and innovative approaches that we didn't have budgeted. Clinical services, 95%. Some of that has to do with the fact of just our general billings and our billings in general and what we anticipate, along with some agreement addenda, which are the particular block grant funds that come to us from the state and federal government. Family planning is included in that, and that money actually was decreased this year. So that's the reason for that. Community health protection, that's immunizations. We're doing really well on immunizations. People are heeding, at least from some of our outreach, to make sure that they get immunizations, and so revenue is generated from there. School nurses, that's again fixed revenue that we anticipate getting, and administrative, that's mostly agreement and addenda block grant funding that we'll get. So at the end of the year, we anticipate to get fully realize our revenues, and most of that is because we are anticipating getting additional billing dollars than we had originally budgeted. Happy to answer any questions that you might have about revenues. Yes, sir.
This is not a question, but I was just thinking as you were talking about the block grants, it would be helpful to me to know how much of each of these pots is contributed with local Buncombe County funds. Could you add another, little piece in there, another color for what portion is Buncombe County versus state or federal?
Sure, I'd be happy to do that.
I think that would be helpful for us because we always talk about how good we are in Buncombe County. And I'd like to know how much we're funding these things so that I can say we are going to do this perhaps in spite of what the state or the federal government does.
From a revenue standpoint, it's probably a better indication or better picture for you to see that at the end of the year.
Okay.
Because what we try to do is draw down the monies that we have from
Everything you have.
federal and state first. But we'll certainly do that. And next month, actually, we're set to present the proposed FY15 budgets, and we'll go into much more detail about exactly where all of those different revenues and all those different pots of money come from. But thank you. We'll make sure you get that information. Other questions or comments?
I love your reports, by the way. I just have to say this. This is such a nice, concise picture of where we are. And any questions I have are not because you didn't do a good job, it's because of my inability to understand numbers beyond 10.
I don't put this together, have a great team of planner evaluators who do that, and they do it in a way that makes it easy for me to see and understand as well, too. So thank you for that on their behalf as well. So also in your packet is a billing guide change, and if you remember, each year we come to you and ask you to approve our plan for charges for the health department. We have to, by law, have a methodology of how we charge for services and how we collect for those services. And we try to only do one a year, but if you remember when I brought this to you back in June of last year, I said there are some changes in family planning that allows us now to require folks to give us proof of their income in terms of establishing what their fee will be. Before, we were only able to take their statement for what their income was. And because we use multiple vehicles to identify revenue, to identify income for other programs, we're not able to do that, even though we may know that someone's income, through our other sources, we weren't able to use that income. The federal government changed their requirements under Title 10 to now allow us to require verification for income. So the billing guide, with the exception of one change that we made related to TB testing, is all about changing the language to make it consistent with the other programs that we have about how we verify a person's income. So you'll see all those changes. You'll see the whole billing guide, and we highlighted the changes, and then you saw a summary of those changes as an additional document that just goes through and tells you what we were changing. It all relates, with the exception of TB, and we just added, to make it for clarity, say that there are client fees for routine TB skin test or test waivers, and we added for reasons such as employment or school admission, so that there would be very clear that we can provide free testing, but if you're asking for employment or for school admission like college, that we do charge for that. Everything else is relating to family planning. Yes, sir?
Family planning billing, that last item, the bills to third parties show total charges without discounts, unless there is a contracted reimbursement rate that must be billed. Would that contracted reimbursement rate likely be higher or lower than our costs?
Likely lower.
Likely lower,
Yes.
okay.
Any questions about the changes or the reasons behind the changes?
Make Jim answer a hard question.
Yeah, Jim, here in delinquent accounts,
Yes.
is that, it just seems, I've read the whole thing, but it seems like it might be written backwards. Family planning patients are not required to meet with the director to collect accounts, or should it be health directors not required to meet with the family planning patients to collect an account?
Oh, man, you did give me a hard question. Family planning
I
patients
helped him find
are not required to meet with the health director in an attempt to collect it.
So they meet with somebody else.
Well, the reason that that's in there is because if someone has a charge that they dispute, the ultimate resolution of that charge rests with the health director, and that's in statute, except for family planning. So we don't, in other words, if someone disputes a family planning charge, they don't have to go to the health director to dispute that charge. They don't have to pay it, and they'll still receive services. There's nothing there that will prevent them from receiving services. So we just wanted to clarify that, so that in case they read somewhere else that they could have to go to the health director to get those, to dispute those charges, that they don't have to even pay those charges. Now, we certainly encourage them to do that, and we certainly want them to do that, but that's what that is. Does that answer that question?
It does, thanks.
Any other questions?
The donations, it's on page 6.
Oh, yes.
What does that mean?
Well,
Maybe I should have asked that question from the response I'm getting, but
under
does that mean?
Title 10,
Okay.
you have to offer someone the ability to provide a donation to pay for their services. So we have to have language in there that says if you want to donate to help pay a portion of your bill, you are free to do so. As opposed to if you get a bill for $100 and you say, well, I'm not going to pay my bill, but I'll donate $5 to pay your bill. It sounds very crazy to me, to be honest with you, but that's a requirement that we have under Title 10, that we have to say that they can make a donation if they want to pay on their bill.
Thank you.
Is that information given to them up front or after they say they'll?
Well, the way we give this information to them up front is we make the billing guide available to everyone.
Jim, do we need to vote on this today?
Yes, in order for this to be effective, it's a two-part process. We ask you to take action on this today. If you choose to approve this, then this will go to the Board of County Commissioners for their approval at their meeting.
So move for approval.
Second.
Moved and seconded. Any questions? If not, all those in favor of the motion, say aye.
Aye.
Opposed, same sign.
Thank you.
Thank you, Jim.
Thank you.
I guess it's good because I saw Commissioner Belcher come in up here and not understanding
He's back
behind me.
Yeah.
But anyway, we're glad to have you, so now this is in your ballpark. Good. Okay, all the people behind us now are very important people, and if you sit here quiet, they didn't even think. So we're anxious to hear them, I understand the gentleman you're gonna tell us. That's me.
I want to thank you for the chance to be here today, quite frankly, because it gives me a chance to tell you why I have absolutely the best job in this entire agency. There are those here that will disagree with me, but they're wrong. I'll just tell you that. I've lived long enough to develop some pretty strong opinions about many things, but one of the things I have a strong opinion about is what does it mean to have a good job? When you work somewhere where you're given things that actually matter to take care of, you're given the flexibility to think about creative solutions to dealing with those problems, and then, in as much as possible, you're resourced to execute those solutions, it really doesn't get any better than that. And that's the spot that I find myself in, and I am just very, very happy to be here. Now, our intent today is to try to give everybody snapshots at what actually happens inside my division. I've encouraged all my folks, much to their dismay on occasion, to push beyond just telling you what they do. I want them to try to help you understand why they do what they do. We're going to begin with veteran services. Everybody sitting here has heard me run my mouth about veteran services before, so instead of going back through all that, what I want to do is approach it a little bit differently. I want to give you the numbers piece that matters, and then I want to go on and talk about why those things matter. Census data from 2012, just to remind you, says that we have roughly 20,646 vets in Buncombe County, roughly 8.4% of our population. Now here's where it gets interesting. From the VA, in terms of compensation, pension, and voc rehab, education type stuff, those vets bring in $57,214,000 to our community. You add on top of that the health benefits that they receive through the VA, which is an additional $77,841,000. That comes out to $6,541 per vet. And remember, about 20-some thousand vets, all of them don't receive services from the VA. Some of them don't even know that they should be receiving something from the VA. And that's our job as veteran service officers to try to connect them. So from a straight up economic sense, you know, it makes good purpose to actually try to invest in folks that can link those people with services from the VA. Direct line of resourcing into Buncombe County. Now that's the economic reason. There's also another reason that in some respects is more important, and that is that it is the right thing to do. Again, part of the wonderful thing about my job is that my boss and my boss and my boss's boss both have allowed us the flexibility to try to do more than just worry about the money. They've allowed us to try to reach out and to help and assist veterans as they show up. And what I want to do before I introduce my presenter in that is to have my folks on the very back row where you'd expect them to be, to stand up one at a time. This is Walt Ward. He is my moral compass. He actually got arrested for civil rights stuff back in the day, so. Sherry Manning is right beside him, this is Rick Jones. And then my presenter is the newest addition to our group. And the reason we have her is because people in this room dared to stretch themselves beyond the economics and look at the reason why we do things. Heather, come on up. Do not be fooled by her. She is a Marine and a mom, and she will hurt you if you mess this up. You don't have slides, do you, right?
No,
Okay.
just have my notes. Good afternoon. My name is Heather Mallory, and like you said, I am a Marine Corps veteran. So I served 2005 to 2010. My first assignment was at Quantico, Virginia, HMX-1, and what I did, I was military police there, so I guarded the president's helicopters. My one goal in joining the Marine Corps was to travel the world, and I achieved that. I've been all over the place with the Marine Corps. I served under President Bush and President Obama, so it was a very good deal for me. With that being said, what I do, I'm a brand new veteran service officer. So in our office, our main purpose is to file disability claims for veterans in the county. So with that, in hiring me, the goal was to reach out to women veterans and veterans that are survivors of MST, which MST is military sexual trauma, which unfortunately has become quite an epidemic in the military. There was, just this week, a report came out that in fiscal year 2013, 5,400 instances of sexual assault or unwanted sexual contact were reported within the U.S. military. And that, from the previous years, is a 60% increase. So that's a lot. And here in our area, we have the Charles George VA Medical Center, which we have a very close relationship with them, which has actually helped me with my own health care. I go to the VA hospital for my own health care, which has served me very well. From the female veteran side, these are somewhat old numbers, so it's increased a little bit, but there's about 6,800 female veterans in our area. 1,400 of those receive their care at the Charles George VA Medical Center. Out of that 1,400, about 377 female veterans have self-identified themselves as survivors of MST. So in our office, we have about 25 current claims for MST going at the time. And that's myself, Walt, and Rick have all done those claims. That's male and female. So it's not only female veterans that were reaching out just for MST, it's also male. With hiring me, they wanted someone that veterans with MST would feel comfortable talking to. Because MST is a very, very personal and quite traumatic thing to talk about. So I want to tell you a story about one of our veterans that's come into the office, filed a claim with us, and actually received an award. And so this is one of the good stories. It's come out of an unfortunate event, but it's very encouraging for our office. We had a veteran come in 2012. While she was active duty, she was repeatedly raped by her supervisor. There was no known evidence, which means she did not report the rape, because the one she would have reported it to was the one committing the rape. She was currently at the Charles George VA Medical Center in a substance abuse rehab program. And with that, due to her disability, she had also lost her job and was residing at the Steadfast House, which is the house for homeless women in our area. They have 10 beds set aside for women veterans. When she came into our office to file a claim, we encouraged her to receive treatment for her PTSD, post-traumatic stress disorder, due to her sexual trauma. Once she received treatment at the hospital, she got a diagnosis for PTSD. And then on the benefit side, which is who we deal with at the VA, they were able to see all of her care at the VA hospital, which what they look for is markers. So they also looked at her medical records from active duty. They look for markers, which can be any type of adverse conduct while you're in, asking for leave for no reason, or anything that would just show, hey, something's going on. So they actually found that in her medical records. She had asked, there was a sudden flurry of gynecological complaints in her medical records. So the VA took that evidence from her medical records while she was active duty. They took all the treatment that she'd had at the VA hospital, put everything together, and they sent her to an exam from the VA, which also established her PTSD diagnosis. She was then awarded her disability rating, and because she hadn't been able to, she remained unemployable due to her disabilities, she's actually now paid at the 100% rate from the VA, which that monthly is $2,800. So going from zero and living at a shelter to $2,800 a month was a staggering, just wonderful thing for her as a woman and as a veteran and as a Buncombe County resident. So she was able to move out of the homeless shelter and get her own home near family, and she's still, what we've heard last from her, she still continues to receive treatment at the VA hospital. That being said, MST is a very, very difficult thing to talk about. So in our office, we try to create the most veteran-friendly, comfortable, secure environment for our veterans, either male, female, to come in and talk to us and pretty much spill the most horrific thing that's happened in their life. And we've got to write it all down and send it into the VA. So that's one of our main goals. And it's just definitely been a blessing for me, working with all of these veterans and working with the guys in our office and gal. And it's just been a very great experience. So that's all I've got. Does anyone have any questions? Yes, sir.
That's a wonderful story, and as I listen and hear that, I know we're dealing in Health and Human Services, but the question I have is, at the end of this, does prosecution ever come as an outcome of some of these things?
Unfortunately, no. While you're active duty, that would have been the time I would assume to go for prosecution, but in the military side, the one that you report things to is your supervisor. I know now things are trying to be changed, but even when I was in, if something had happened to me, one person I would go to is my supervisor. And if the supervisor was the one doing it, then I wouldn't have gone to them. So for the prosecution, it's not happening. What we're trying to do is get this benefit for the veteran, and that's all we're looking at. Yes, sir.
Terry and I have a long history with Fiscal Legal Services, and I have a 20-year history with ABCCM. What is the specific relationship between the department and the nonprofit organizations that focus on some veterans' needs in the community?
We work very closely with ABCCM from the Veterans Restoration Quarters. Walt Ward actually goes there once a week. So every Tuesday he's there filing claims for veterans, answering questions, whatever he needs to do. I work very closely with the Steadfast House because they have 10 beds for female veterans. I don't go there as often as Walt goes to the VRQ just because there's such a smaller number. But just recently I went out and did a class. I got all the female veterans logged into eBenefits Online, which is a source for veterans to go in, look at their claim if they have something open. They can also request letters be sent to them, all kinds of things. So I got them all, well, except for one, which we're still working on that. But we got them all logged in. With Pisgah Legal, I know the county has a contract with them. So we do refer veterans, if they need their discharge upgraded or any other legal advice, we do refer them to Pisgah Legal.
Health and Human Services has both a child and family law and an adult law contract with Pisgah to serve our consumers.
Yes, sir.
I have a two-part question. So the diagnosis for 100% disability is sexual trauma?
No, the diagnosis is completely separate than like the 100% disability rating. In order to get a disability rating, there needs to be a diagnosis. So that's why our relationship with the VA hospital is so imperative to what we do, because we can refer any of our veterans to the hospital for treatment. Once they receive their treatment, if the injury or mental disorder is there, they will get the diagnosis. And then that's where the VA on the benefit side links up with the VA on the healthcare side, and they can make that link.
So the other part of the question is, so after treatment, is there a process of evaluation to see if there's improvement of the condition, or does this 100% award for disability continue for life?
Well, not everyone gets 100%.
This person you
Right,
gave
this
that
person
did. That's what I'm
specifically, it
asking.
depends on what it says on the letter. So for her specifically, she was, I believe, at 70%. She was being paid at the 100% level because she was unable to have employment. She was unemployable due to these disabilities. So the VA can, and this actually is a good question for Walt because he did this for 30 years, but the VA will assign a rating to a veteran, anywhere from 0 to 100% for a certain disability. And then depending on that type of disability, they can say that no further exam is needed, or they will set an exam date for a further date, a year, 2 years, 5 years, whatever it may be. So not always is it for forever. Mhm. Yes, ma'am.
I've read, just in the paper about horrendous backlogs with the VA. Is that
Yes.
still the case? Or
Absolutely, it is. What we're doing on our part from the county's standpoint is they've come up with a new form. So we're using an EZ form, which means it's called a fully developed claim. So we fill out all the paperwork with the veteran, include any type of medical records for that specific disability, and then we send it in. So that type of claim gets processed a lot faster than the old type. So unfortunately, there still is a large backlog. We actually just went to Winston-Salem, I believe it was last week, and visited and saw who was working on what unit would take care of what type of claim. But on our part, that's what we're doing, is we're using the EZ forms to hopefully get a faster claims process. And also, with the homeless veterans, because they are homeless, we can actually request for, let's see, what is it called? Priority processing for their claim. And that's because they are in that homeless veteran state.
Thank you.
Any other questions? Okay.
What's
Thank you.
interesting about this, as I listen to this, I remember back in the days when I worked for the county, we were involved with evaluations, and we had problems with people who were being evaluated by supervisor, and they had nowhere to go. So we provided them the opportunity to automatically be able to go to that person's supervisor. I would really wish that the service would do the same thing on these type situations. But I don't know whether that's still in place or not, but at the time it was very important. And it'd be nice if that person would know, I can go to that person's supervisor.
As Kevin jumps in, I would just make the point to the board that when Kevin's division last presented, it was this board who pushed us to look at hiring a female veteran and really strengthening the outreach and particularly looking for expertise around sexual trauma in the military. So thanks to the board for giving us that leadership vision so we could find the resources and clearly a great talent commitment to our teams.
The only other thing I want to add before we shift to adult services is to point out that there is a move afoot in VA land to try to make everything electronic. Veteran will be able to apply for services, apply for disability from the comfort of his own home or the library where they have access to a computer. That makes a lot of sense, except for one thing. If you've ever seen one of those forms, you would. If you understand it, you got way more credentials than I do, okay? The reality is those folks on the back row there, and then Heather sitting up here, are a living resource to help folks do that, even if everything finally goes digital, because they know the right language, the right ways to connect things, the right way to say things, to actually give the VA the information they need to make a good decision. Okay, so let's shift to adult services. Now I've struggled, you can ask my boss, I have struggled with with what I want to say by way of introduction, because I can see something in my head, and I'm having a lot of difficulty trying to find a way to pull what I see in my head out and say it in such a manner that it makes sense. I even ran my data by some really smart folks, including some PhDs that I talked to this morning, believe it or not, that focus on community stuff to see if the numbers that I'm looking at have any merit other than just something that I ate for dinner last night. And actually, apparently it does. Let me try to paint a picture before I give you the number. When you get the demographics from the census, it breaks everything down into all kinds of categories. One category that it breaks down is people under 18. So if you look at that category for Buncombe County, it will tell you how many people under 18 in 2012 we have. It'll also tell you the number of adults that we have that are 65 and over. So if you look at a county and you compare the really young, the under 18, and you compare it against the folks over 65, it should tell you something. Now, of course, my question is, well, what does it tell you? But if you think about it, imagine Haywood County. If I tell you that there are more, let's just call them old folks and young folks, just to make it easy, okay? It's politically incorrect, but go with me on it. If there's more old folks than young folks in Haywood County, that wouldn't really surprise you, would it? I mean, because it's basically rural. There's not a high degree of industry there. There's a lot of retirees there. If I told you that about Henderson County, that probably, again, would not surprise you because there's a lot of retirees there. And in fact, if you actually run the numbers on those two counties, in Haywood County, for every one old person, there's 0.84 young person. In Henderson County, for every old person, there's 0.86 young person. Now, if you think about the opposite of what rural and retiree community would look like, you'd be thinking someplace like Charlotte, right? I mean, there's kind of like North Carolina's example of what a big, big urban county would look like. Well, it turns out that in Charlotte, you have, or in Mecklenburg County, 3.7 kids for every old person. So you see, you've got a kind of a bell curve in opposite directions. One for the urban, and then one for the retirement community. And this is where the magic starts. There's 10 urban counties, right? Of which Buncombe is one of the urban counties. So if you compiled and looked at just the urban counties, and you looked at the statistics that way, you actually find something kind of interesting. You've got Charlotte at one end, Mecklenburg at one end, with 3.7. And everybody else staggers down, and then Buncombe shows up. Buncombe shows up way different than everybody else's and shows up at 1.18 kid for every old person. Now, if you run the statistics so that it's a little bit clearer and you can compare it, if you take the 10 urban counties, Buncombe County actually has 5.6% of the population, just inside the urban counties, right? We have 4.7% of the kids. Not a huge number, actually, if you think about it. Remember that other number I told you, 5.6% of the population. We have 9% of the people that are 65 and over. What Buncombe County is something different than what Mecklenburg County is. We're an urban county that's like old. I don't know another way to say it. You know, we have retirees, or maybe another way to look at it is what we have are single people who don't have children, and then when they have children, they leave the county. But whatever we have, what we know is we have way more elderly, 65 and older, than we do young ones, percentage-wise. Having said that, it leads me to create the opportunity where I have folks that are going to talk to you about that. We administer stuff through Leanne Landis-Scott, and I'm going to ask her to come up and tell you why she does what she does with our resources.
good story.
It was a good story, wasn't it? Thank you, Kevin, very much for that. And he kind of leads right into why am I here today and why are we talking about older adults? It can start at the federal level, where back in 1965, the Older Americans Act required everyone to start looking at ways to protect older adults from unfair discrimination in the workplace, as well as to provide protection and services to help older adults remain independent in their homes. And what's kind of neat is the Older Americans Act started the same year that Medicaid and Medicare did, 1965. Come down to the state level, there's a lot of initiatives there as well. The Livable and Senior Friendly Community Initiative of 2006. There's a North Carolina Senate Bill 448 in 2007, where it identified Buncombe County as one of the 6 counties to watch, because they knew our demographics were going to be changing, so they're watching us right now. Closed circuit TV or one of those screens, or who knows how they're watching us, they're there. And the governor had an executive order in 2010. He said our state needs to be ready for the aging population. I have a kind of a side note to that. We don't need to be ready because they're already here. We should have been starting this probably 20 years ago, but that's part of the Older Americans Act. So here locally in the county, I think Kevin alluded to a lot of these statistics here. In 2010, you can see the population, 22.5%. That's about 53,000 older adults in Buncombe County. I like this statistic. If you add in the boomers, those born between 1946 and 1964, which is those older adults who are coming in to being older adults, 42.8% of the population. That's a lot. That's a lot. And again, as Kevin alluded to, the 0 to 17 is just 20% of the population in 2010. What's neat about this as well is that Buncombe County, see if I can get this, it's kind of a difficult statistic to understand. Buncombe County has the most older adults of all counties in North Carolina when you look at those counties that have more older adults than young. Does that make sense? Our county's #1. So we're leading North Carolina in a lot of ways. 2030 estimates really mimic this as well. The older adult population is going to grow, as well as the boomers, and that 0 to 17 is going to decrease. So the issues, I don't call it a problem, the challenges are only going to increase. So what's Buncombe County doing? Well, they have been doing a lot. Back in the early 90s, Buncombe County formed what's called the Aging Coordinating Consortium. We shorten it to the ACC, has nothing to do with basketball or anything like that. But it provides a structure for agencies and individuals to work together to plan and promote community awareness, advocate and support services for older adults. So Buncombe County really had the foresight to see this early on in the 90s. Something needs to be done. We need to get a group together. This group serves as an advisory board to the county commissioners, and we meet the fourth Thursday of each month at 2 p.m. And again, anyone's invited to that meeting. We'd love to have more participation on that. And you can see what the ACC does. These 4 points here. And what I'm going to focus on specifically is the aging plan and the aging funds. I hope you know that we have a Buncombe County aging plan. Whoops. And I have just a couple of copies of this I will pass around. And I'm sure we can put this in the presentation or in the minutes so that folks can look at it more in depth. The beauty of this is not a plan that you do every 5 years. Oh, this is great, wonderful. Stick it on a shelf, and in 5 years you look at it again. Buncombe County, again, is leading the state in that they have this plan, and they have someone who is in charge of taking this plan and meeting the goals each and every day. Buncombe County has money that they have hired Linda Kendallfields as the aging plan coordinator. She's not responsible for getting all these things done, but she's responsible for working with those in the community who can get them done. So she has these 6 categories here. Within each of those 6 categories are 14 goals. They're outlined in detail in this plan, and it's available on Buncombe County's website as well as ours. This plan, the beauty of it, not only is it active and vibrant and moving on, but it helps in the way that we distribute the aging funds that come into Buncombe County. In this current year, Buncombe County receives almost $2 million in aging funds to help our older adults. The first pot of funds comes from what's called Home and Community Care Block Grant Funding. That comes from the Older Americans Act, remember we talked about before in 1965. It's funding that comes down through the federal government to the state of North Carolina. The state adds in just a little bit to that pot. This comes to us every year, and it provides certain services for older adults. Some of those services are transportation, adult daycare, in-home aid, home-delivered meals, legal services, the list goes on and on, but there are certain services that this pot of money can fund. Again, the beauty of Buncombe County is that Buncombe County adds another significant chunk of money to this block grant funds, $543,000. That is a lot of money to supplement what block grant is given as well. And Buncombe County, with these funds, can provide additional services that the block grant money cannot, such as on-track financial services and assist with our senior Tar Heel legislators. A few of the outcomes in FY13, you can see those. Of those 2,200 older adults that were able to live in their home, it cost Buncombe County $900 to keep them at home. I think that's cool. That is cool, because if those folks were in a nursing facility, we're looking at $50,000. So we're able to keep folks in Buncombe County home for $900. Now the big question is, why haven't y'all heard about these programs before? There's such a need. Well, the wait lists are huge for these programs. The wait list for in-home aid, believe it or not, can be up to 2 years because the need is so great in Buncombe County. We try to prioritize and to help those folks that need it the most. We maintain wait lists in all the different categories, and we try to help as many folks as possible. When someone does go on a wait list, we don't just say, sorry, you're on a wait list, we'll call you in 2 years. We try to connect them to other resources within the county as well, because we don't want them to suffer when we want to help them any way possible. I want to share a video from one of the services, and I want to say from the get-go, the Senior Companion Program is a program through Land of Sky Regional Council, and hopefully this will put a face to what these aging funds do.
Julio is a man that's been independent most of his life. When you get to a certain age, you need help from somebody, and that's where a senior companion comes in to help out. I've been with Julio for 4 years. I guess he got used to me in a lot of ways. You know, he depends on me a lot. My dad and my mom always taught us to help somebody else, somebody that needed help. One day he broke a finger, and I told him, I said, Julio, you have to go to emergency. And I said, don't worry, I'm going with you. I knew he needed help. I knew he didn't want to be alone, but I was there with him. And I made him happy because of that. It goes both ways. It helps him, it helps me.
I got sick one Saturday, and I didn't want to alarm my family, so I called her, and she came over. She called 911. I stayed in the hospital 3 days, and when I came home, every morning she wants to know, could she do anything? So when she found out what I was doing with the beads, she offered to come stay with me a few hours at nighttime, and I showed her how to make the beads, and she's been a great help.
I do things for her that she's not able to do, you know, like combing her hair and like getting her clothes upstairs to wash them in the washing machine, those kind of things. And that's what I help her out in doing. We're very close.
Euphemia seems like a daughter to me, really.
I take her to the drugstore, and I do some cooking if I don't hear from her, you know, looking at her. So her daughter seems to be very thankful for that.
My daughter feels very good about it, knowing that she has somebody that will contact her or somebody I can contact in the event that I'm sick.
There's a lot of people that do need some help. You know, instead of just sitting there, come out and get involved.
When I first started working with Maria Luisa, she was a different person altogether. Now she is very, very good at carrying on a conversation with me. Now she sings, she dances.
When Amelia came to us last year, we suspected that she'd be a good fit for Maria Luisa and her family. And this is a letter of appreciation that Maria Luisa's daughter has written. Mrs. Baldini is very caring. Her love, professionalism, and responsibility have changed the critical situation we had at our house due to my mother. I really can say that it has been a miracle.
As soon as I get there, she's waiting there for me. And we go into her room and we do some exercises or things with her that she wants to do. Then we'll go to the bakery. They treat her wonderful there. I feel like I've grown a lot, and I think that she has grown a lot with me because she does so many things, and I'm so, so proud of her.
Senior Companions are the greatest group of volunteers. Without us, seniors who are frail and need help could not continue to live in their homes. Families get respite, and volunteers prove their value to the community. This is an innovative, cost-effective program that has real impact.
That program, again, is administered by Land of Sky. Volunteers locally here provide transportation, light housekeeping, meal preparation, medication reminders, and of course the socialization that you see in there. And we do it for roughly $5 an hour for this program. You compare that to perhaps an in-home aid level 1, you're looking at probably triple that amount there. One volunteer a year costs about $5,000. They help roughly 5 individuals every year, so we're right at that $900, $1,000 level again of keeping folks at home. And of course the older adult who's volunteering as well has helped through this. Last slide, because I don't believe in death by PowerPoint, not this time of day after lunch. This is a quote, actually, does anyone know who the quote's from?
Benjamin Franklin.
Benjamin Franklin, even though there's a typo in that, and my apologies for that, an ounce of prevention is worth a pound of cure. Apparently my Southern was coming out as I was typing away. But if you say it fast enough, it sounds just like a pound of cure. This is an old problem and occurs in many forms in the community, but spending money such as on drug prevention programs is usually more cost effective, of course, than treating or incarcerating drug users. Programs to keep healthy people healthy are much cheaper than paying for expensive medical treatments, and the same is for this. Seems like all the money that's out there for older adults is for once they get into a nursing home, once they need that care. We're trying to do that preventative way. And Buncombe County is really trying everything they can to keep folks at home and to age in place. Of course, again, money, as Kevin alluded to, is a big economic factor. The cost to maintain one older adult in a nursing home under Medicaid is 50 times the cost to provide services to help someone remain independent in their community. 50 times the cost. The main reason, though, and again, as Kevin said, why we do this is because it's the right thing. When you talk to older adults, they do not want to go into a nursing home or to a facility. 90% when asked, they want to remain in their own home. Even when they begin to need day-to-day care or assistance, 82% want to remain in their home. Living under one's own rules is the key reason that older adults wants to stay at home. And I just want to mention 211. I hope that that is a resource that everyone here in the room knows about. If you, a family member or a neighbor, has questions about older adult services, this is the card to give them. This is a resource that I use each and every day. Of course, 211 is an entity that you can call for any questions. I referred someone this morning over the phone. They needed dentures and were low income. Who do I call? 211. Give them a call and they will help you through it. On the back of it is a list of Buncombe County partners. These are folks that will help older adults take it to the next level. Perhaps someone needs dentures, but they also need transportation. They also need in-home care. They need a housekeeper. They have multiple levels that are going on. These are partners in the community that can help walk them through that. Options counselors can assist them. Free service, doesn't cost anything for this, for either 211 or the options counselors. And again, I just want to end by saying thank you for this opportunity. I think Buncombe County is leading the state. They have an aging plan that's active. They have an aging plan coordinator who's working on this aging plan every day. An active committee of the ACC that is looking at older adult issues every month. And then, of course, dedicated funds. So I think it really shows how Buncombe County loves her older adults and is caring for them on a daily basis. Any questions?
I'd just like to make a comment. I
Sure.
had the pleasure of presenting to that ACC group, and they are so incredibly motivated and wanting to just connect and reach out and work with any organization out there. And I mean, they're doing it for very little, so I definitely commend you.
Thank you very much. And we can include information about the ACC in the minutes as well, so that folks can attend. Yes, sir.
In the assistance for the elderly, do we provide or utilize any of these services that provide individuals with trained dogs that can assist? It doesn't have to be, they're almost like seeing eye dogs. I met a woman recently who works for an organization, national organization. She lives here in the community, and she helps train these dogs, and they distribute them free of charge to people who need them. And so they wouldn't be perfect for all kinds of situations, but they train these dogs to do a whole bunch of things.
I don't know about that resource, and that would be something I would call 211 to find out more information about. I know we have the Division of Blind in this area, that they work a lot with the seeing eye dogs and so forth, but not that I know of, but what a great resource that would be.
It's a great idea.
Yeah, it is. Take it back to the ACC and see what we can do with that.
So are all of these folks Medicaid eligible? What's the criteria to get in-home assistance?
Actually, under the Older Americans Act, it is not means tested. You just have to be 60 years of age or older. But because funds are so limited, each of the providers that we work with try to work with those who are most needy. Those who do not have resources in the community. They don't have a support group. They don't have a faith-based community. They have no one else. They're literally at home, stranded at home, is what we say from time to time. Those are the folks that we want to reach out to, the ones that are most at risk for the institutionalized care. So again, those wait lists are huge. We're looking into the thousands of folks who need this service across the state. Here locally, we're hundreds of people are wanting this. And if we were to advertise it, it would be thousands. It truly would.
Good, great job.
Thank you. I don't do it myself. I'm just here today. It's a coordinated effort, a team effort all across Buncombe County. I'm just very proud to be part of it and to be able to share this with you all today. Thank you.
So I have one other group that will share information with you. They'll be coming up. Come on up, ladies. I'm going to step toward the center of the room as they walk by, just to make sure they don't have knives and stick it in me as they go by, because I will tell you, while they are absolutely fearless in their pursuit of trying to take care of adults, they don't like doing this.
I heard of it.
If you do one of those 360 valves, I'm doomed. But here's the thing. I wanted, and it's Roxanne and Lori and Kathy, and they're going to tell you why they do what they do. One of the greatest things that Jennifer Chilton lost when I took this job were these three folks, and I am so thankful. Just to share the workday with them. They push me, they challenge me. They would argue with the doggone wall if the wall gave them reason and cause to argue with it. And underneath all of their thought process is trying to take care of adults. And it's just so cool. Having said that, I am going to shut up, very carefully exit the other direction.
Do I look like a knife carrier? No. My name is Lori Dotson, and I have been with the agency for 20 years this year. And I'm going to tell you just a smidgen about myself. I am, I think, the only person in the agency who has the job that I have. I do a blended unit of child protective and adult protective social work. In 2006, when I had my little boy, I became an on-call supervisor, and that is when our agency integrated and did both child and adult into one intake unit, and then our on-call unit also became integrated. So that's when I had an introduction to adult protective services. We put little purple bracelets in front of each of you, and they say "Stop Elder Abuse." I had the privilege growing up to actually live with my papa. When I was 13 years old, my grandmother died very suddenly, and my parents moved me and my two sisters out to Fairview from East Asheville. It was awful, we thought, and now it is a place that I treasure in my heart and hope to die there someday. But we had the opportunity to take care of my papa for 20 years. And I know because we moved in and helped take care of him that sustained his life and enriched his life greatly. And I do what I do in the adult world every day as an honor to my parents and to my papa, to try to make sure that all adults have that ability to have the respect and love and care that they deserve. And unfortunately, what I find some days is that not all people are as passionate as they are about children as they are about adults. And so it's my hope that I can in some way help make adults' lives better in a little way every day. So our division, that's what we do. We protect elderly, but it's not just the elderly. We also protect any disabled adult. And we try to protect you from adult abuse, neglect, or exploitation. So our little organizational chart, just to show you who we are. Kevin is our fearless leader, and then we supervise together, Kathy and Roxanne and I. We have 7 Adult Protective Service investigators who investigate complaints. We have 3 planning and mobilization workers who provide ongoing services to adults who have been identified as in need of protection. We have 5 adult home specialists who monitor homes here in our county, and Kathy's going to talk to you about that in just a second. And then we have 2 contract workers. One does the special assistance in-home that Leanne was speaking some about, and Kathy's also going to tell you a little bit about that, as well as a part-time contract worker who provides oversight for adult daycare. So with that, I'm going to let Kathy come up and talk.
Leanne talked to you about the Buncombe County Aging Plan, and without a doubt, the goal of the Buncombe County Aging Plan is that adults are allowed and provided with resources to age safely at home. 2 of the programs that I'm very proud of that our agency provides that assists adults in remaining in their own homes is Special Assistance in-home, which is intensive case management and sometimes a cash supplement to provide some sort of health and safety need that the adult needs in order to be able to stay at home. And also adult daycare, which is a wonderful program, and I wish we had a lot more funds for it, because it allows respite for a caregiver, thereby allowing them to take care of the adult in the home a lot longer. Sometimes it allows the adult to keep the adult's caregiver to keep working so that they can maintain financial solvency for the family. While we all know that everyone wants to stay, 90%, I think Leanne said, everyone wants to stay in their own home. There does come a time when, for some adults, they don't have the natural supports or the community resources to be able to maintain themselves in their own homes. And at that point in time, DSS and Health and Human Services can step in and provide placement services. We do that sometimes just by giving information and referral to our clients, and sometimes even engaging in service planning and being more hands-on in providing resources so that an adult can find an assisted living or nursing living facility. We have 5 adult home specialists in Buncombe County who oversee and monitor 87 adult care homes and 4 adult daycares. I'll bet that none of you would have expected that we have more assisted living facilities in our county than in any other county. Wake, Forsyth, and Mecklenburg have a few more of the larger adult care homes. The 7 beds are larger, sometimes hundreds of beds, but there's not a county in the state that surpasses us in sheer numbers. So that's a lot of visits every month. That's a lot of regulatory experience we have. While these social workers are fully qualified as social workers, and we're employees of Buncombe County, and we certainly never forget that, we are also agents of the Division of Health Service Regulation, as they like to remind us. In that job, we develop a strategy to monitor each home as often as possible. We are mandated to go quarterly. However, usually our practice is to try and at least go monthly. We pick rural areas and strategize how to hit every rural area so that we can provide the best possible care in a facility. The reason I come to work every day is because I want those individuals that don't have the natural supports and resources to be able to stay at home, to have a quality living experience. That means we're going to be in that home monitoring their personal care and supervision. We're going to be monitoring their medication administration, the doctor's orders, their care plans, and the admissions and discharges in that home. We rely so much on our integrated partners in Health and Human Services. We could not do the job we do if we did not have environmental health, making sure that kitchens are safe, making sure that building is safe, and if we didn't have communicable disease partners that make sure that we have TB testing and that all of the disease control measures that are possible are used to prevent outbreaks in these facilities. When we monitor regularly, we can sometimes identify deficient practice, rule violations. When we do that, we do not leave that facility until we have a protection plan in place, and we come back and we write a corrective action for that facility. And then we go back and monitor to make sure that deficient practice is cleared up. Sometimes, because of the scope and severity of the infraction, we actually write penalties. Nobody, not any of us, can put a dollar amount on a human life. But an economic sanction is one of the measures by which we can hold a facility accountable. Locally, we don't have the authority to uphold that penalty. We can write that penalty, go before the Penalty Review Board in Raleigh, and then have that penalty upheld. We can also recommend licensure actions, such as a suspension of admissions or closing a facility, but we don't have the local authority to do that. We do work very hard on maintaining an effort to improve our practice whenever something like a critical incident happens. That's the whole driving point. It's never a gotcha, now we're going to make you pay for this. It's how can we, as adult home specialists and as educators, help others not make the same mistake so that it never happens again. Are there any questions about? Yes.
Is there public access to find out if any of these 87 adult care homes have had a citation and penalty?
Absolutely. And I'll be happy to guide anyone through looking for any particular facility. On the Division of Health Service website, you can just Google NCDHSR. There's a listing of all the penalties that have been imposed, and it's broken down by county. Also, all of our monitoring reports and all of our corrective actions are public documents after they've been approved by the division. So, you know, anytime you have any questions about a facility, we are happy to share that information with you. Thank you. I'm going to let Laurie and Roxanne talk about adult protective services.
Jennifer Chilton was so gracious to help make a pretty graph, because if it was up to me, it would be very unintelligible. We just wanted to show you a little bit about our numbers, and our numbers are growing, and that would be expected by all the information we've been provided about the population in the census. Since July of 2012, we've had 1,690 reports that were accepted for evaluation. Of those reports, 155 were for abuse, and abuse is considered either verbal abuse or physical abuse of an adult. There were 1,414 reports of neglect, and neglect can be by a caretaker or caregiver of an adult, or it can also be self-neglect, where the adult is actually neglecting their self. And then there's 402 for exploitation, and exploitation can either be of an adult person or of their assets. We've had, of those cases that we evaluated, 443 were substantiated. That means that we found that there was abuse or neglect and that the adult is in need of protection. The thing with adult services that is very different is that adults, as long as they have capacity, have the right to determine whether or not they're going to stay involved with our agency. And Roxanne's going to talk with you about that a little bit after the video that we show. But it's important to know that if they have capacity, they can decline our services. So out of those substantiations, you can see that more than half actually declined our services, which they have the right to do. And then we have to simply walk away. The Adult Protective Service statute that gives us the authority to do what we do was established in 1975, and it's 108A. It gives the department, well, it gives any person the mandate, if they feel like an adult is being abused, neglected, or exploited, to actually call our agency and make a report. Once that happens, there's 3 criteria that we have to look at. We have to see if the adult is disabled and incapacitated by that disability. Also, it has to be that it's already occurred. It can't prevent abuse, neglect, or exploitation. It's that it's actually already occurred, and that the adult is in need of protection. So what is a disabled adult? I'm just going to ask for a show of hands from people who don't understand what we do. If an adult is in a wheelchair, do you feel like they would be a disabled adult? Yeah? What if they were blind? Okay. What if they got a Social Security check for disability? Would you think they're disabled? Well, they may be disabled, but that alone is not enough for us to become involved. They actually have to be incapacitated, and that means that they have to have assistance with their daily living activities. So just because a person is blind or just because a person is in a wheelchair doesn't mean that we're going to get involved. It has to incapacitate them, and we really try hard to help people understand, because there are many functioning people who have disabilities, and that also needs to be taken into account. Right now, if I can show you this video, if I can get it to work. We're going to show you this video to kind of give you a glimpse of what we do every day, and then Roxanne is going to come up and talk about capacity.
Under North Carolina law, local departments of social services are responsible for evaluating the need for protection of elderly and disabled adults. With the economic situation as it is, exploitation of our disabled adults, many of whom are also elderly, has become the crime of the 21st century. Exploitation is often a crime that is perpetrated by the very people who are closest to the disabled adult. The disabled adults are often most vulnerable due to social isolation, physical or mental disabilities, and are often dependent on the very ones who are exploiting them. This vulnerability makes them an easy target, and the shame associated with the exploitation makes them hesitate to report.
Like, I just need you to sign this right here, okay? And this will help so I can take care of things for us.
What is it?
It's just a document that lets me take care of bills for you, you know, so that we don't have to You don't have to be involved in everything all the time. Here, just take the pen, will you, Mom?
I can't read it.
We don't need to. You don't need to. I'm telling you what it is.
Due to the number of elderly and vulnerable, financial exploitation is a growing problem in our society.
Exploitation is a serious crime, and it's one that we all must pay attention to.
It's a shame that elderly in our community are afraid to report when they've been victims of abuse, neglect, or exploitation.
What people often don't understand about financial exploitation is that it's perpetrated by someone in the family or someone else that has a close relationship with the vulnerable adult.
Exploitation is often a crime of opportunity. A power of attorney can be granted legitimately, but then the person who has that authority determines they can do whatever they want to with the adult's assets.
Now, I just need you to sign this right here, okay?
Daddy used to do this.
Daddy used to do this, you know, but I'm doing it now because Daddy's not doing it right now, okay? So I'm sort of taking Daddy's place. So here, you just take the pen and you sign it and everything will be good.
Let Daddy do it.
Daddy can't do it. Daddy's gone on a trip, remember?
Financial exploitation always has components of emotional abuse and occasionally physical abuse.
Adults are often afraid to report incidents of abuse, neglect, or exploitation because they're afraid that the alleged perpetrator will withdraw care from them.
Come on, just sign the paper. Right there. That's it. That's good. Come on. Good. Go on. The last name, too. Put your last name, too. Come on. Cunningham.
Often the adults will have signed the power of attorney, deed of the house, may have signed checks, but even if they didn't know what they were signing, it's no less a crime.
Mom, you're not making marks. Mom, you got to make marks on the paper. Make the marks. You could do it. Come on. Cunningham. Here, come on. Let's do it together. Write your name on the paper, Mom. Please just write your name on the paper. Come on. Mom, don't. Come on, Mom. No, you're just doing this. Mom, you have to sign the paper. Mom, you got to sign the damn paper. Would you sign the damn paper? Sign the damn paper, Mom. Come on. Come on. You do it if Daddy asks you to. Just do it for me. Would you just sign the paper? Just so I can get things fixed up for us so we're okay? Come on, Mom. Sign it.
How terrible it is to reach the point in life when you should have some comfort and realize that someone that you loved and trusted has taken advantage of you and used your assets for their personal gain.
All right, Mom. All right. All right. I tell you, that's real good, Mom. Give me the pen. Good. That's real good. I tell you what. You can wear your wedding ring tonight. I'll get it out for you. You can wear it tonight, okay? Okay? That'd be nice, huh? Wouldn't that be nice? Thanks, Mom. Thanks, Mom.
People see exploitation, but don't often realize what's behind the
Angie directed us and said we were running out of time. So we weren't going to be able to watch the whole video. Which is unfortunate because it's a really good video.
We'll send you all the link.
Yes, it's on YouTube actually. My name's Roxanne Seidel and I supervise adult protective services. And I only have one slide that I'm responsible for, I think because they think I'm the one that carries the knife. But you can put this out of so where to get this aside. Right. But generally the video, if you watched it in its entirety, would evoke a lot of opinion. And I guess just from the short, brief period of time that you watched the video, you probably have an opinion of what you think about the sun. Anybody want to share what they think about the sun?
You want to hear?
And it only gets worse. It only gets worse in the whole video. And this is what we would call a substantiated case. Because just from the brief moment that you watched it, you can tell that she probably has a disability. That there's a dementia of some sort going on with her. And although the video talks a lot about exploitation, there are elements of abuse, and of course caretaker neglect if you had gotten to watch the whole video. And the thing that I like most about adult protective services is this slide, in the sense that with adults, if they have capacity, much like she alluded to, then they have the right to refuse or accept services. And what capacity basically means is if that adult's able to understand the consequences of staying in that environment and choose to do so, regardless of the risk, if they they understand the consequences, and they have the right to do that. You know, that's probably the hardest thing for communities to really appreciate, because it's really, really hard. It's really, really hard for social workers who have to leave somebody in a situation that's high risk because they refuse services from us. Now, if that adult lacks capacity and they don't have a guardian or a power of attorney, which are the only two people that can actually sign for protective services, then we're going to have a legal intervention of some sort. And I just want to tell you briefly about a case that I actually personally was involved with. It illustrates really well capacity and lacking capacity. We had a lady who was bedbound, and she lived alone, and this was a case of mine, and she had minimal assistance in the home. She may have a neighbor come by and put out food or clean her up if her hygiene suffered because she was incontinent. I knew that she was at high risk if we left her there, because if a fire happened, she couldn't get out of the home. But she was as alert and oriented as you and I on a good day. Not always alert and oriented, but most days. And she refused any services. Thankfully, she said, "But you can come visit me." I said, "Okay." So I went out there every day and met with her. And on the fourth day, she was hallucinating, she was delusional, she didn't recognize me. And so we immediately got a ex parte protective service order, and we took her to the hospital. And at the hospital, they determined that she had terminal cancer and was dying. Now, I knew that she didn't want to die at the hospital. Most people don't. And so fortunately for her, she had resources. She had money. She could have paid for 24/7 care at home, but she chose not to. But at this situation, we were able then to go in and get an interim guardian for her, where we could make personal decisions and manage her finances. And what we did with the help of the hospital is we arranged 24/7 care, got her back home, and within an hour she died. And that's why I do this job. And I've been doing it longer than Lori, but I'm not going to tell you how long. Of course, I started when I was 12. Andy and I both started together. So, but most importantly, and I want to just briefly talk about the disability piece. I want to make it clear, age is not a disability. There are people in their 90s who would not meet the functional definition of disability. And we are very fortunate in Adult Protective Service that we have the most amazing team that I am blessed every day to work with. So, that's all I have to say. Any questions about Adult Protective Services? I really wish you could watch the whole video.
I'm Krista I would just like to say thank you, because I'm aware of a recent situation in which you all were tapped and have intervened, and the individual's in a much safer situation. And thank you for that, because that was, one of those 2 degrees of separation from me, but I knew a lot was going on in that space. And so it just feels better to sleep at night that she's somewhere where she won't wander, which is how she was found recently. So.
Any other questions or questions?
Folks, that's my story, and I'm sticking to it.
Dr. Whitener had asked me about updates for some winches data, and Carlos is actually inviting us over there to hold a meeting and do a tour and look at their new numbers. We are investing in some which will go before the commissioners next month, some expansion going into the next year for additional slots. So we are going to schedule to go so the board can tour again and get all the updated data. So I appreciate you reminding me of that. So. Carlos is out, and that's something he is sharing with people, just to respect his personal information. He is sharing that he's out on intermittent leave right now with his mother involved in hospice. So you're arranging a schedule, and we will meet there. You've seen, some of you toured the clinic, but I don't think everybody's toured the clinic. So those of you who haven't done it in a while. So that's all I have.
Does anyone else have any announcements or anything they'd like to share?
Motion to, I'm sorry, we're talking about health.
I just want to mention that today is Eddie's last day as a Buncombe County employee. And I want everybody to know, so we can embarrass him.
You can take your name tag with you.
Because he's been such a great, employee. And
He really is a great employee. I've said forever, Eddie's the guy you want to show up. Anytime you're trying to manage a crisis or run a disaster, he never drops a ball, never misses a detail. He's focused on everything. And I apologize, that was on my original list before we did disease control. But I thank you, Eddie. Working with you has been
It's
absolutely
been my
wonderful.
pleasure. Thank you.
Eddie, on behalf of the board, I can't say thank you enough. You have helped us so many ways in keeping us informed of community happenings. Thank you.
Thank you, Dr. Mullins.
Mandy, how long has it been with the Buncombe County?
Do you want to tell them, Eddie, how long and all the things you've done?
Oh my gosh, been in Buncombe at 26 years, was in Burke County 2 years. Lots and lots of years in public health, had the privilege to do some work in economic services in the last year. But the number one single most thing that I'm so thankful to get to be a part of is the effort of integration of health and human services. And when you look around at each other on our board, that's such a reflection of the expertise and community partners at the table. So thank you.
From the commissioners, thank you